We are tracking breaking news from the World Health Organization. Leaders today saying it's declaring a monkeypox global emergency. The WHO chief is calling the expanding outbreak in more than 70 countries a, quote, extraordinary situation. A global emergency is the WHO's highest level of alert, but the designation does not necessarily mean that a disease is particularly transmissible or that it is lethal. The WHO did make the decision to call the monkeypox a global emergency, despite the lack of consensus among experts there. And joining me now to discuss this new global emergency is senior scholar at the Johns Hopkins Center for Health Security at the Bloomberg School of Public Health, Dr. Amesh Adalja. Thank you so much for joining us.
Sure. Thank you for having me.
And health officials say that the overwhelming majority of cases are in men who have sex with men, but it is not classified as an STI at this time. We do want to clear this up with you. Why is it so important to not stigmatize this as an MSM-only disease? And can anyone, in fact, get monkeypox?
Traditionally, monkeypox has been able to infect anyone. It just so happens in this unique outbreak, it has gotten into a sexual or social network, and the majority of the cases are in men who have sex with men. We have seen some spill over into the general public, but right now, I think what the key thing is getting those countermeasures to people at risk. And in the United States, it does happen to be men who have sex with men. There's nothing stigmatizing about it. It's just that this virus got lucky and got into a certain network and has been spreading efficiently throughout it.
I mean, but does saying that the virus is largely spreading in one group give the larger population a false sense of security here?
Not necessarily. I think you want to be truthful about what the epidemiology is showing, and it is clearly clustering in that population. However, we need to get control of it so that it doesn't have the opportunity to spill into the general population. So it doesn't change anything, and it doesn't mean that you have to have a false sense of security, but it's also something that you don't want people to panic about and then line up for the vaccine when they're not really going to be benefited by the vaccine the way a man who has sex with man might be.
Understood. Well, we know that our public health agencies are dealing with a trust problem with the public right now, absolutely coming out of the pandemic. Do you think that in this moment, the public's faith in the CDC and the WHO is perhaps too damaged to effectively guide Americans through another medical crisis, whether we're talking about monkeypox or any other?
I definitely think that's a major issue. That's something we warned about during COVID-19, that there would be the next infectious disease emergency. And if the general population only looked at this as something through the lens of identity politics or felt that public health was completely politicized, it was going to come back and haunt us, because we need people to trust public health experts, infectious disease experts, to be able to help them guide their life in a world in which there's going to be future infectious disease threats. And I think correcting this, it has to be is a pressing issue that needs to be rectified.
At this point, I know you do point out that this is really a majority affecting the MSM population right now. What would you say to the average American? Is there anything they need to be aware of or anything they need to watch out for when it comes to monkeypox?
Right now, the risk is low to the general public. However, if they're in contact with somebody who might have monkeypox or have risk factors for exposure to monkeypox, they should be aware of it. They shouldn't just think of it as something that's completely unable to infect them. They should really also be very supportive of the public health efforts that are going on to get vaccine to those at highest risk.
And what would you say in one or two sentences to Americans who do not trust the CDC or the WHO right now?
It's understandable after what happened during this pandemic with all of the mixed messaging and failures with messaging. However, you have to recognize that there is subject matter expertise that resides at the CDC, that resides at the WHO, that will help us fight this infectious disease emergency and the next infectious disease emergency. And I think it's something where you really have to go back to the history of the CDC and see how instrumental it's been in protecting people's health, and really view what happened during COVID-19 as an aberration.
All right, doctor, thank you for your time. I appreciate it.
Thank you.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.